I'm here today to talk a little bit about the optimal ways to use your nasal steroid spray. In my career as a nose specialist and rhinoplasty surgeon, I also find people who have functional issues with their nose, certainly allergies and the like. And often people are placed on, and patients are placed on nasal steroid spray to help with these. And certainly there are some ideal ways of using the spray that often we as doctors fail to mention or bring up with patients. The first is that you really have to use it daily. It doesn't work well every third day, every other day, once a week. It really takes a consistent use, and finding it as part of your routine, doing it after you brush your teeth, after you shower. Those are ways that I find that help with patients remembering to use their spray. Additionally, the patients need to realize that the spray doesn't work very fast. It takes a good month or so before the medicine starts working. And so after a week or two, if you don't find much effect, that's because it hasn't really started working yet. And to really keep with it, and I generally tell patients really to use it for 2-3 months to really give it a fair shot to see if it's improved your symptoms at all. A few other tips that I give patients when I prescribe the medications is to how to hold the medicine, how to really apply it. And so I'll use a bottle to show you. The first is to hold the bottle in your right hand when spraying your left nostril, and then switch hands. Use your left hand to spray your right. And naturally what happens when you hold it that way is you angle the nozzle just a little bit off center so it doesn't hit your septum. And that really is often what causes nosebleeds and irritation, and another reason patients often stop using the medicine. The last trick that I have is to hold the bottle upright facing the ceiling and then tilt your head forward and downward like that. And that gives a natural trajectory where the medicine will get back to the back of the nose, really apply the medicine ideally, versus using it just like this, where patients often will do, and the spray will hit the top of the nose and dribble back out and really just end up irritating the top of your nose. And lastly, a lot of patients say, you know what, Dr. Lamperti, I'm using the sprays just like you said. I really don't like the taste or the smell of my medication. It just doesn't agree with me. And there are various medications available, and they do have different scents, and some people don't really care. They're just happy that it works for them, and other people are really bothered by it, and that's fine. And really, it's something you have to talk with your doctor about. And there are different alternatives, and they don't all smell the same or work the same with regard to irritating, perhaps. Most people tolerate them fine if used right. Really talk to your doctor about perhaps switching to an alternative medication if you don't tolerate the initial choice.